Welcome to another episode of the Chronic Comeback podcast. This week, I'm really excited to have on the show Dr. Stephanie Canestraro. Hopefully, I pronounced that correctly. So just a quick introduction to Stephanie and her story. So Stephanie actually suffered with symptoms since she was very young, with multiple food sensitivities due to gut infections she didn't know she had. Seeking the help of doctors, unfortunately, no one really took her seriously, and it ultimately developed into something a lot more extreme and a lot more serious for her, and what is known as celiac disease. Added to this, she experienced a number of other symptoms, inflammatory issues with her nervous system, unexplainable body aches, panic attacks, and even had her hair falling out at one point. She was told she had IBS and that nothing could be done. She, however, did not agree and went and made it her mission to find out what was wrong and heal herself. It took many hours and thousands of dollars, but through her own research and using functional medicine principles and to help herself heal today, she has improved significantly and actually helps others do the same via her own practice, the Vegas Clinic, and via her own Instagram, which is how I found her, where she's consistently putting out great and inspiring content to help and inform others. So thank you so much for coming on the show. Really appreciate it.
My pleasure. Thanks for that intro. That was very well put out.
No worries. So could you take us back earlier on? You mentioned and that's where I got the information, on your website. You mentioned that it was early on in your life something wasn't quite right. I know a lot of people go through life without chronic issues, and then suddenly one day it happens. It sounds like it was a lot earlier for you. Could you talk us through that?
Yeah, I mean, it kind of ebbed and flowed. It's not like I was like a severely sick child, but, it started off, as you get sick and you start to ask your parents, well, was I breastfed? All of those kind of questions. They were like, well, you were like our problem baby. So as a baby, they couldn't put plastic diapers on me. You know how they have plastic lining, like my skin would like shed off. And so they had to do cloth diapers and they had to wash it. I couldn't drink from a plastic bottle. I would get tons of reactions around my mouth. And they explained like my skin would like bubble and peel off of me essentially. So something was going on with me from like a very young age, right? Like, and I actually work with babies now and start to explain to parents how these things can start so early. But you can carry these kind of things into adulthood, but your immune system kind of catches up a little and then you're okay for a while. But I always had like skin symptoms as a kid, eczema. I always had digestive issues. Like, I remember being really young and having like stomach aches, and I thought, oh, I'm never eating pizza again or something. And and then it kind of progressed. Like then I was in high school and I had this one episode where I had like such bad heartburn that I couldn't lie backwards, right? It would just like burn and come up, and it was scary. And then that's when I started with the whole Tums thing and like trying to go to the doctor and seeing what's going on. So yeah, it was kind of just like this ebb and flow of like, you'd be a little bit like stable for a little while. Maybe the summer months were better because you had, more vitamin D or whatever, like little things that, I haven't really quite figured out, but we kind of go through these phases. And so, I mean, there's obviously different stressors, different bugs you can get exposed to or hidden infections, but, it's hard to pinpoint exactly. But overall, it was just, I was always like kind of like the canary. Like I had the car sickness, for instance. Like we would drive to Florida every year and my two siblings are fine and I'm like puking out the window. And I now know that that's partially from imbalanced gut microbiota. So I help people with that kind of stuff all the time now. I couldn't read in a car. Now I can read in a car. I was, so just all these kind of little things that just, now I can see that it's just like you weren't functioning fully properly. There was things that needed to be addressed.
Yeah, because I always because now I have to really watch what I eat and, get certain reactions to things and then things. And I often think, God, when I was younger, even, in my 20s, just eating absolute crap, but able to just be okay on it. And yet you weren't able to go through that. Like that must have been really difficult, like growing up and being around your siblings, but also your friends when you're going to social things. Was that difficult throughout your childhood?
Yeah. And I don't even think I realized how sick I would be after every like party where you would eat, like, maybe not as healthy as usual. And we grew up in an Italian family. Like my grandmother was a caterer and my grandfather would bake all the time. So it was all like gluten, like fresh pasta, fresh this. And so, I mean, I ate all of that stuff, but I was sick until I figured out that was causing me a big problem. I think what the tipping point was, and I think this is what happens with most kind of chronic disease. And like, my body was trying to like cope with it and it could kind of get by, but then you hit a point and when, there's lots of stress in your life or, you're maybe not living in the best, when you're in like college or university, the housing is kind of like moldy and subpar, right? Like no one's going in there and making sure you're living in like a clean environment. So, and then, you might be partying and then all the things come together that was holding my body so that I wasn't like complete into chronic illness. And then it just like hit a tipping point. Like, so, we kind of lose that ability to cope. And then we break our coping mechanisms or our toxin bucket completely overflows. Like I explained to people, we each have like a toxin bucket. Let's picture it like that. And some people have a bigger one based on genetics and all these other things, environment they're raised in, a lot of childhood stuff. And once it overflows, that's when we get like to the point where, it took you until your adult years. But me, maybe I had a smaller cup. Maybe I was starting off with a disadvantage because, I was eating all this, wasn't eating the best even as a kid. So, all of those things kind of come together and then you end up with a symptom pattern, right? That honestly ends up being so similar for a lot of people with chronic illness. But like obviously there's differing things, but there's always just way more than one layer. And I find it with men. I work with a lot of men. Like I feel like your testosterone protects you and that's a good thing, but then to a fault, because then your tipping point is a little bit more like drastic. It's not like this slow kind of introduction into chronic illness. It's like tipping point, sick, chronic, that's what I kind of see.
It's interesting you say that. I mean, I wasn't, first of all, I was going to say that I think I probably had a pretty big bucket, but then I just thought, no, I'm going to tip in even more toxins so that eventually it will overflow. But
yeah, that makes sense.
So with it's interesting you say that about men, because so obviously I reach out to a lot of people to come on the podcast, and I've looked into kind of statistics around it and stuff, and there's very few men, that, well, first of all, put their message out, and that's just the way men are, right? They're probably not willing to go out there and talk about it. But it does seem there are a lot less men who suffer from chronic health issues. Is that your findings as well? You said you work with quite a lot. It's just interesting because I also come across, whenever I've been for treatment and stuff, is the odd guy there, but it is mainly women. What are your thoughts on that?
Yeah. So, I mean, part of it is like hormones, like estrogen's a little bit more inflammatory overall. It's protective of some things. But then when you see, even a lot of the men that end up coming in that have like chronic disease, they're a little less, they're efficient at clearing estrogen, is as a common thing. So I think that's one of the things. And like I said, testosterone is highly anti-inflammatory, stimulating growth hormone. There's a lot of, healing that's building, like anabolic, right? So I think that is protective, but I think, like I said, I think sometimes it ends up being like way more drastic with them. Like they go from, or I don't know if they ignore their symptoms a little bit more, but what I'll say from working with I work with generally like healthy athletes that are men, and they're like in the NHL and mostly, but I worked with NFL. I worked with golfers and all that. What I do find is that when you dig, and when I started sharing my story or what some symptoms are of certain things, their eyes and their ears perk up, because I think there's like a little bit of the conditioning that comes in that like men are tough, don't talk about your problems, and so they try and cope in different ways. And, sometimes that's like, they don't realize that anxiety is like, can be connected to your gut. And instead of like, asking someone about that, they're just drinking to, ease their sorrows kind of thing. So, and then you get into that slippery slope where they're depending on like sleeping pills to sleep. They don't realize that interrupted sleep can be like a toxic liver, parasites, or blood sugar imbalances, or, not having patent airways and not being able to breathe properly that can wake you up in the night. And instead they just kind of silently suffer through it. They're taking tons of sleep pills and whatever. And then, they have to be like pretty bad in order to like share that, or someone has to like pull it out of them. And then women are just more likely to talk about what's going on, small symptoms. Some of them are even more aware. And so I think sometimes it's protective, because when you are like, there's that saying, the canary in the mine, because like, they'd have canaries down there because if the carbon monoxide goes up, they're going to be the first to die, and then everyone has to exit, right? So that canary in the mine kind of where you feel your body a lot, like it tells you a lot, it can be protective, because your body's telling you something's wrong a little bit earlier, and then it's not some like catastrophic disease that you have, or you're not in like the end stage of the disease before you find out you have it, right? We hear of those people, they're like riddled with cancer and like drop dead before they had a symptom, right? So I guess you could look at it as it's protective in that way.
Yeah, it's interesting because I actually had a guest recently who we were talking through, and she clearly had started, the beginnings of symptoms, and immediately then looked into it and didn't take doctors' words for it, medical doctors, and went down her own healing journey and kind of cut it off like early on. Whereas I, had symptoms, got told I was fine. So I just bulldozed through it and just carried on. And if anything, I was like, they're telling me I'm fine. I can continue on doing what I'm doing. And what I'm doing wasn't conducive to living a healthy lifestyle. It was, going out, drinking, partying, pushing myself in every element of my life. But yeah, you're right. I didn't share with anyone in my life what was going on. So yeah, it's just really interesting to talk about it from a male perspective, because we probably will get the odd, male listener that, maybe every now and then would want to hear from that perspective. But going back to your story, you mentioned the tipping point. And for me, there was definitely a tipping point. So, I'd really like to hear a bit more about that. How old were you when it got to the point where you were like, I cannot live like this, something has to change?
Yeah, so I'd say the ultimate tipping point, because like I said, it ebbed and flowed. There was a bad time in university, but I kind of got it under control just with like, I thought, okay, I'm drinking, I'll stop drinking. Like that was enough for that time. But this was the end of chiropractic college. So, probably around 2009. That's when it was my, like, where I was like in and out of the hospital, like very sick, like almost like what felt like psychotic breaks, like panic attacks, where I threw my bed out in the middle of the night. I thought bugs were crawling all over me. I would have stroke-like symptoms one day, and I would be taken to the hospital, injected with like gadolinium, so that they could check that I'm not having an aneurysm. And then if they don't see any stroke or anything like that, like you're sent home. And then I was like bleeding from my bowels, like 100% just passing blood. And then I go in and, I'm dosed with like a flagellate, a different antibiotic and another antibiotic, because they didn't culture it first. Then I get a reaction to the flagell and I have acute pancreatitis, and, not to mention like I was having like muscle fasciculations all over my body, which is like and it's very troubling for anyone that's had this, they'll understand. And you feel like something's not right. You feel almost toxic, and your muscles are just on their own, just twitching. Like lots of people have had it, like a twitch in their eye or whatever, but it would be big muscle groups where it was like visible. And so sometimes my muscles would go into full spasticity as well, where it would do like, which is like a Charlie horse, but often. So picture all over your body, just like that like, like ball of muscle. Like, so that was already happening for a while. And, I was going and they would do a nerve conduction velocity test where they put these electrodes on and then they stim and then they're like, oh no, you're fine. But, then you find out a nerve conduction velocity, you have to have like 50% damage of your nerve for it to show up. So then you get sent to another specialist that does like an EMG. So then they stick a huge needle in your muscle and then make you flex with the needle in your muscle. Okay. To then give me the diagnosis that I do have fasciculations. Yes, indeed. And I'm like, well, I already knew that. Like I was feeling them, like, couldn't you look at it? So then you go through that. And then of course, all the muscles that they shoved those huge needles in were like like going crazy because, they were already damaged. Damage was happening. I was in a toxic state. No one, and then, you go through your own kind of sickness thing and then you get through it and then you attract those same people. So I have a lot of people that have those same like kind of crazy symptoms and like, just being able to explain to them like what's happened and then like peeling back the layers of like what's the cause, like why would that be happening, like that's empowering to people, right? No one could tell me that at that time. Like no one could give me an ounce. Like they look at you like you're crazy until like something shows up and then before that you're just like, you look healthy, your blood work's fine, just like they kind of did with you. Like,
yeah,
I mean,
yeah.
And
so talk us through the next progression of that, because that's where you're coming at against many dead ends and where well, actually, can you talk us through the mental state that you were in there? You mentioned like panic attacks, and I think I read on your website like an impending sense of doom constantly. How obviously that's what I was going to say. How was that? Obviously, not very good.
That was great.
Not the best time of your life, but how long did that last? And how did you? That sounds like it's your darkest hour. Like, how did you dig yourself out of that to keep going and not just accept that the kind of this is how things were?
Yeah. So, I mean, I've always been someone that like doesn't really take, what people say as like, I always question things. Like, so I knew that something else was wrong, but that sense of impending doom, by the way, was when you think that your death is around the corner. Like I was saying to my parents, I won't make it till 30, like this is it for me. If, whatever, this isn't sorted out. So I don't know. I just got a surge of like, this is not how I'm living. And I ended up getting an MRI and they found like some specks in my brain, right? So if you don't have 5 plaques, like white matter, that's when it's demyelination. So every nerve is surrounded by like a myelin sheath. And in certain autoimmune diseases, like the myelin sheath gets destroyed, but it does for a lot of other reasons too. So there's like a misdiagnosis, a lot of people getting told they have multiple sclerosis, right? So that's kind of what they were insinuating that I had, but you don't have it because you don't have 5 plaques. Okay. And so now I go, okay, so what does that mean? They're like, oh, nothing. You just go home. If it gets worse, then we treat it. And I'm like, well, that doesn't make a whole lot of sense to me. Like something's obviously going on. So I think that was the point where I took my health into my own hands and like truly like 100% without like still trying to go to like conventional doctors. Like, not that I don't think there's a time and a place for them, but I don't think that chronic disease is the time and the place for them. And these issues were definitely chronic and something. So anyway, I looked to the internet and I actually was, because they said MS and they were scaring me with that kind of word. That's what I kind of looked up. And I found a TED talk from Dr. Terry Walls. And so, she's telling her story, and she was in a tilt recline wheelchair, and she was diagnosed with MS with, where it was actually like progressing and she couldn't walk. And she had gone to like the Mayo Clinic, the Cleveland Clinic, and done all of the things that like, all of the experimental drugs that like we wouldn't even have access to because she's an MD and she had like, some certain connections, and she was just getting worse and worse. And so she realized, these are the nutrients my nerves need to heal. Like maybe I'll take more of those. So she saw like mouse doses and she made them into human doses and was dosing herself. She was vegan and she realized that that's not the best source of nutrients. So she started eating like organ meats and more vegetables, because you can be vegan and not be eating enough vegetables at all, because there's like junk food kind of veganism. So I did a drastic change to my diet, because I had been going to the doctors for years about just intermittent diarrhea, constipation, right? And then it turned into just pure bloody diarrhea, like that kind of when I got really sick. But, nothing's wrong. And I asked them to test me for celiac disease, and they just, oh, no one really has that. It's just IBS. You're going to have to deal with it. You live with it, or you could take these steroids, or, anyways, like maybe a probiotic. So I tried all those basic things and it didn't really help. So, so I really changed my diet where I cut out gluten, right? So gluten wasn't part of it. Dairy wasn't part of it. And, I started feeling a difference. So then I actually got tested for celiac and had that. And, but then after changing my diet, things start coming in. My boss at the time, so I did my externship in chiropractic college with someone who's like a very smart, like sports medicine kind of chiropractor. And so he's like, you should do this parasite cleanse. So I did, I dove right into, now I do parasite cleanses on people, but a little bit different, because they didn't do like binders or anything. So like, it was really hard on my body. Like I was in bed for days with like flu-like symptoms, but I passed like parasites and I felt better. And then, some guy muscle tested me, which is when they use your own arm to push and see which supplements are good for you. Told me I had no stomach acid. So, I started using stomach, betaine, HCl, and I started feeling better. And so it was just like little by little, I just started to heal from peeling back. So, and then, down the road, I find out that I had Lyme, a Lyme co-infection, probably either from, because I was getting bit by bed bugs, by the way, which I didn't know when I was in chiropractic college at one of the low-rise apartments that we lived at. And I also had another big risk where I could have got exposed to it, is I had something called dry socket when I had my wisdom teeth taken out when I was in university. So my earlier 20s. And dry socket is one of the highest risks for getting like Lyme and Lyme co-infections without being bitten by a tick, right? Because everyone thinks that Lyme disease is only from ticks, but it's actually being proven that there's a lot of other vectors of where you can get exposed, or like passed on from other people that were exposed. So, because I had like some of these like lasting symptoms or other symptoms that would pop up, like heart palpitations, like, and then, then looking into like this co-infection I had, well, it does cause a lot of muscle fasciculations. And I was like, oh my gosh, like, so all of these things, started appearing to me and then molds was a problem. And then that was the most recent thing that like, I cleared my sinuses. I did a test for my, a nose swab, because I was having like lots of like boogers from my nose that were awful. And it was almost like creating like a hole in my nose. Like it was so painful. I'd never had a sinus thing. And, I did a nose swab and I had like Marcons, which is usually something's lowered your immune system, mold, Lyme, whatever else. Like there's multiple things like parasites do as well. And then this bacteria that's a normal part of your nasal microbiome, or the bugs that live in your nose, overgrows and gives off these exotoxins and lowers something called melanocyte stimulating hormone, which is something that like gives us lots of energy, protects our skin, helps us sleep, like all of these different things. It gets lowered and your immune system goes off. So clearing that and opening those nasal passages. So now that was the last thing. So I sleep better, less heart palpitations from getting rid of like Bartonella, which is one of the Lyme co-infections. Like that has all been fairly recent. So within the last 2 years, where I was able to peel back more layers for what was bogging down my own health. And, being able to share that with other patients that are going through similar things or are right at the, precipice of them feeling completely awful. Like, you get to kind of empower them and have more of a plan for them than just kind of like, just roughing your way through it, is the way I kind of explain it.
So where are you at today, like in terms of like how you feel? Are you still, is there, I know people often put like a percentage on it and kind of like, where you would like to be. Where would you say you're at?
Right now at this exact moment, like I'd say like 90%. Like the only thing is like around my cycle, which I still get cramps, and that's like driving me crazy, because I did have a few times where I was really good and on the ball with all of my eating and everything, and I didn't have that. But other than that, like, being able to control the anxiety and not having heart palpitations and sleeping through the night, like feeling calm in the morning, like, I didn't realize like waking up with full blown anxiety was not a normal thing. Like,
Yeah.
So, yeah. And so I guess the last thing is like, I can't do like really hard workouts like I used to without having like really bad, like delayed onset muscle soreness. So I kind of have to grade my workouts. So I'd say those are the two biggest things that I know that I can work on by like lowering even further my toxic load. So, and sometimes I feel like it's because I'm so much better that I'm not like so strict with my diet as I was, that like that kind of crept back up. So you kind of know what to do, and sometimes you're not doing it because that's human nature. So, just like being able to realize that even with other humans and work through it, like we usually are motivated because we're not feeling good or something's gone on, like, or at least that's for me. Like most people won't be super proactive. So just like trying to do that for myself and then reiterating that to my patients, because for instance, my nose was a problem, and I kind of like, I would do some stuff, it would feel better, and then I would leave it until it came back to fully being bad again, so learning to not do that even for myself, like, and everyone has different strengths and weaknesses, and I just happen to procrastinate sometimes. So just learning what yours are, your Achilles heel, and trying to strengthen those things.
Yeah, it's funny because like I guess you've got a few things that you kind of still would like to sort out, but then compare that to like a normal person, normal in inverted commas, like in everyday life who's never had a chronic issue. Everyone's got like little things they would like to sort out, and it's very rare you get someone that was kind of like completely healthy. But I assume that if you'd asked the version of you in that darkest hour that you were in, like, fully, in the depths of it, whether, they ever thought that you could get to the position that you're in now, I mean, would you have ever believed them?
No. I mean, I would never have even, I just spent the winter in Dominican. When I stepped foot into the Caribbean, I was so sick in my insides, like I couldn't do that. Like, I was like just a delicate flower. Like I couldn't, I couldn't make plans for anything without knowing that I could feel awful one of the days and, not be able to function. So I don't feel like that anymore. And there was a time I didn't even think I would be able to have a career, let alone, be working with like top athletes and Hollywood people and being flown around here and there to, work on them to help regain their own health or just to optimize. So, no, like, I mean, it's like night and day. I literally, at one point I was seeing like 25 patients a day. And before that, I couldn't even get out of bed, so it's like, it's polar opposite. So now it's just like, I guess I want to feel like my absolute best.
Yeah. Well, that's I mean, that's my goal, that, when I'm kind of get to the position that you're in, where there's like still, then it's like, okay, well, the next level is feeling better than the normal people do. Like, then, I want to get to that next level that people probably aren't. people normal people again, they're eating badly. They're not aware of these things, so they're never going to get to that stage because they've not got the motivation and they don't know what's possible. But yeah, no, I think it's amazing that you can get from that position, and just, people listening to this who are in that position now, to have that belief that they can do that, through hearing your story, I think it's amazing. What's your view on like the emotional side of things and how that can, because you mentioned anxiety. I'm personally doing a lot of like reading into a lot of work on various different types of meditations that are and various different reading, which is going back to not necessarily trauma that's like really bad, really bad thing that's happened to you, but just bad, anger or anxiety that's then manifested itself in other things. Do you think that's played a major role in your symptoms and your issues? And if so, like how did you go about addressing that?
Oh, definitely. I mean, there's that whole saying, like, you don't need to know the type of disease the person has, you need to know the type of person that has the disease, because we even like certain personality types are more prone to develop certain issues, right? So in like trauma, like you said, comes in all different shapes and forms. It can be, middle child syndrome can be traumatic for someone, even though it may not be that bad. But I feel like that was something that because when I was really sick, I feel like I couldn't access healing or meditation in that way. I was way too much in fight or flight. So, I think once I peeled back a layer or two and I started feeling a bit better, and then you see the world a little bit different and you start reflecting and you're like, how did I become like this? Like, I'm a people pleaser. I put everyone before myself, like not filling my own cup. Like you start to learn stuff about yourself. And then, I couldn't meditate for the life of me. And I was not, so I never really, I try not to say that to people, like try and sit there and get into a deep meditation, when you're like heads like spinning. So there's different things we try and do, like, guided, like just things that change your train of thought were huge for me. Like Abraham Hicks, like Joe Dispenza, even Anita Morgiani's book, like Dying to Be Me, like she was someone who was like really sick, and then, she had a near-death experience. And then I dove into like all these near-death experiences because they were so enlightening to me, and they take away a lot of this worldly anxiety for me. So I try to guide people, like for whatever their beliefs are and for whatever, whatever empowers them, but definitely like clearing blocked emotions, like emotions being trapped in different parts of the body. Like I'm starting to explore more and more for that, for not only myself, but, referring other people to certain people that are talented at helping guide that side of things. But I mean, I think it's a huge part of healing. And, I named my clinic the Vagus Clinic, and, the vagus nerve is your gut brain connection. It's your 10th cranial nerve. And it's in charge of your parasympathetic side of your nervous system. So that's your like rest and digest. And that's also the side of your nervous system you have to be in order to be in a meditative state. Right. So, we do some mechanical things to start to activate your vagus nerve so that you can then, do it with like meditation but when you're meditating, you're in the side of your nervous system that your vagus nerve is in charge of. So, accessing that and being able to access and turn on your vagus nerve will give you the ability to, unlock and unravel those kind of deeper hidden things and in your body, and even generational healing. Like there's all of these, like we're energetic beings. We give off different vibrations and energetic fields, and you can make yours healthier by like releasing a lot of these trapped like frequencies, if really that's what they end up being. And then I think that plays a huge role. I just think being cognizant of when you're in your darkest hour, I realize how hard it is. Like sometimes you need like a little bit of like the mechanical healing to then turn it on. But if you have someone that can do it a different way and they can clear some of those right away, then I think that could be powerful. That just, I didn't feel it was accessible necessarily for myself, but I know a lot of different people that I didn't know then. So,
Yeah.
like,
Yeah.
mm-hmm.
I completely feel you with the meditation stuff. I did like Vedic meditation for like two years, and it was like 2 years of just me sitting there and people saying I was meditating and saying, you're still getting stuff from this, but I just wasn't switching off at all. I had some good responses with like Wim Hof breathing, that kind of worked for me. But actually more recently, which I've talked about it far too much on this podcast, people will be getting annoyed with me, but I've been doing a lot of work with Joe Dispenza work. So you mentioned him earlier. And I'm actually booked, by the time this episode comes out, I would have been on one of his advanced workshops. So I'm going in Cancun in just like about 3 or 4 weeks, but I'm doing a lot of the like the online courses at the moment, and it's really good though. It's what I need. It's like pushes you beyond the point of like where you would normally get up and give up, and I think it's something that I need. I just get so jealous of other people who would just sit there and within a minute they're arms out, like they're in a really really transcendental state, but for me it just takes a long time. But I've had like glimmers when I've been doing his longer meditation of how it is where you switch off, and so I'm kind of hoping that going to one of his the advanced workshops where I've actually spoke to a few people who've been to them, the energy in the room that actually helps you as well. But I completely it resonated a lot when you were saying meditation didn't really work for you, but it seems like the perfect way to calm your nervous system down when you're in such a fight or flight phase. I mean, do you meditate now?
Yeah, so I do, like, I have a brain tap because again, I do feel like I need that little bit of stimulation where it's guided and it's got the binaural beats, which help me a lot. Like even just listening to like a 528 hertz like frequency, like will calm me down if if I'm feeling anxious, and then get me into a point where I can feel like I'm getting something out of quieting my mind. I use breathing a lot, but I use like cold therapy. I use like tapping with like toothpicks. I teach a lot of my patients that. I actually just had someone, be able to stop a seizure by turning on their vagus nerve with just a toothpick. So, I use that, but I think I had my very first like true, like full meditative state. And it was by accident. I was snorkeling in Dominican. That's where I spent the winter. And we had stopped to go snorkeling, but like the whole group had gone out without me. And then I'm like, I just didn't feel safe. There were boats going by myself if they didn't see me. So I'm like, I'll stay around this catamaran. And there was no reef there, so I didn't really plan on seeing anything. And I'm kind of floating there, just enjoying like that floating sensation. Because a lot of my meditations are me like in water, like that floating, like that kind of, ones where they're like picture, water coming up to here. Like that's always like, it's always water for me. So I see a turtle and I just start like following it, and I'm, like the sun's hitting me, like I'm feeling like, wow. And I just start following it. And then the ocean goes from like super shallow to all of a sudden like this deep depth of like darkness. And I was like, okay, scared a little bit. And then out of that depth comes an octopus, like just like coming up out of like the depths of the ocean. And I literally haven't felt so calm in my entire life, like watching this octopus. And at the same time, I want to yell back to the boat and be like, I see an octopus, like, because like, I don't know why it was so magical for me. And I couldn't stop talking about it. And I literally felt like it was easier to meditate that entire week after that. Like I felt in a Zen, and I'm not like naturally a Zen person. So, now like I think back to that time when I need to go into like that meditative state. So I think it's just finding something find your find your octopus. I
Yeah.
don't
Like that.
know.
What would you say, like, let's say, you lived a life where you hadn't had all the issues when you were younger, and you'd gone on to, maybe gone to chiropractic school and gone down a different route. How is your life, or, can you see now how your life is better? And if so, what are the ways in which your life is better now than it potentially could have been? What are you grateful for?
Yeah, I'm grateful because like without that experience, I feel like I was super close-minded, like, and maybe just immature like a lot of us are, but it just opened my eyes to like the healing power of the body and like how much we're not in touch with nature. Like I don't know when I would have got to that point where um you see things so differently, and then able to like use something that you're super passionate about and like share that with other people to help them. Like that's fulfilling, obviously. Like, so I don't know that I would have just like, being a manual chiropractor been fulfilled, or what I would have found for my own fulfillment. So I guess in a selfish way, it's taught me how to help people. And I don't know if you've noticed, but chronic disease is becoming more and more of an issue, and I only foresee it becoming worse with the current state of the world. So people need this help. So I just think, if you can harness your own suffering so that other people don't have to suffer, or you can help guide them out of it, then yeah, like I couldn't see it any other way at this point, really.
Yeah, I actually think the more and more people like yourself that who've been through chronic health issues are like then ultimately go into a practitioner role to help people, the more people will recover. Because for me, working with someone who's been through it and can actually empathize with you and connect on a level that just another doctor can't is super powerful to give me and whoever it is the belief that they will recover, because there's an example right in front of you, and just they get you and they understand you. And
Mm-hmm.
yeah, I just think it's super important that, well, not super important, I mean, I'm not pushing anyone to do anything they don't want to do, but just be
Yeah.
so amazing that people are doing that. And I actually didn't realize, I worked with doctors for years who had never had chronic health issues, never got it, and I didn't even realize that it was a thing that many, I thought it was maybe the odd person might go and do that. But do you feel like that
Mm-hmm.
you connect with people who are going through that, like on a deeper level, your patient?
Yeah, 100%. And people will tell me, and they always are like thanking me for sharing their story, because I'm not trying to be like above them when I'm well and you're not well, and like, I have authority over you. Like it's more of like teamwork. It's more of like everyone's so different and unique. One thing that works for one person may not work for another. Like some people find it hard to get through certain protocols. Like, so knowing like how to pivot, how to troubleshoot, how to dose people, how to like all of that, like, if you don't have like that kind of empathy, like you might just think that they're like just, oh, like this person again, like, you know what I mean? Like, but you understand because you were that person that couldn't take a single thing without having a reaction. And, I would take something, they're like, do this supplement, and I'd wake up and my eyes bulging and like, we're like, so I think it's just, and even the coaches that work with me, they all, the health coaches all had their own like severe kind of chronic issues that they had to work through. And like, even some of my friends that want to start working with me, they got really sick. They were working in a conventional kind of setting, and everyone was like saying that my ideas of what was wrong with them was completely wrong, and they weren't fully bought in. And then, I think if it wasn't for my story and just being like persistent and getting them, to make the changes and kill the thing off, then once you go through that, then you see how powerful it is. So just like having those people also coaching them is like another layer of like reassurance, and yeah, just like helps us get results as well.
Definitely. And just final question for me. What would be your advice to someone who is in the depths of, going through something right now, very similar to what you were going through, and, they can't see a way out now, and they can't picture, the progression you've made. They're like, that can't happen for me. What would be your advice to them, more from a mental point of view?
Yeah, I would just say to them, like, our body is like more powerful than you'll ever know. But I would also like, have them, as they reach out for care and find someone that jives with them, like they have to, it has to make common sense, right? I think what happens with most people is they think that someone's much smarter than they are about what's going on with their body. And if someone tells you you're okay and you're not okay, like, you just don't ever go see them again. You've got to like be like your number one like advocate of finding who's going to help you. If what they're saying does not resonate, doesn't make sense, it's not right. Like, it's just like, if they can't explain to you your symptom, if they've never, and if they make it your fault, or if they tell you it's just stress, like, you've got to just move on until you find the right person. And my other advice is that when I got sick, I was in the hole, like $100,000 or whatever. And I have a lot of people talk to me about, money. I don't have money. I don't have this. Like, when it's your health and you find that person that you drive with, and you find that person that's going to like really advocate for you and like try something new when something isn't working, and like, refer you to the right person if they don't know that's right. Like, this is worth investing in your health. So that's another thing, because sometimes like I feel like people put that in their own way because supplements aren't free or covered like some healthcare things are, and they try and go the route where it's like more like invasive or against their own, what they actually believe is good for them, because it's covered or because of that. Like, invest $5,000, $10,000, $20,000 to save your life is nothing in the return on investment, like, obviously. So I guess like my whole thing is just like, there's always a way. There's always a way, and you have to be persistent until you find the right person. And then also there's so many like free things that you can do these days. Like I said, I used to get people to use a toothpick to get them out of panic attacks. Like, they're tapping certain acupuncture points for your vagus nerve. There's like so many resources that, hopefully don't continue to get censored on like things like social media. So yeah, follow people that are maybe not in the mainstream when it comes to chronic stuff, and like just be persistent at your own ability to heal, because your body is magical.
Awesome. I wished I'd listened to that when when I was going through all my stuff, and constantly coming up against people that were telling me I was fine. That would have saved me a lot of time. But I completely agree with you on the side of things. Like, I won't stop spending money, and I'm consistently can't believe how much money I continually spend, but I will keep doing it until it works. Like, it's not even a negotiation. And I do think within your means, like, obviously with people, you don't have money, but even when you don't have money, still spend what you've got. Like, if you have to, that's
get a loan for your health. That's something like, I stand by that. Like, obviously if you've found the right stuff that's working, like, don't ever let money be the issue. Like, if we talk about mindset, we could go into manifestation and we can go into all of that, but like, picture yourself with more money, picture yourself healing, use that at the very least, just like, it's just, if you're in this chronic state, there's stuff bogging you down, and there's the mental, emotional, spiritual side. There's what's inside your body that needs to not be there. And then there might be like some, nutrients that need to be repleted and all of that. But like, if you can get like the mindset thing ahead of that, like faster than I did, then maybe, you don't need some of those other things.
Yeah.
So. Mm-hmm.
Well, look, thanks so much for coming on the show. It's been amazing. Could you, if people want to connect with you, is that best to look you up on Instagram, your website? What's the best way of them doing that?
Yeah, Instagram is a great way. I try to answer everyone, even through DMs there, or forward it to my assistant. And then the website, we're working on growing. We're going to have like a membership, but not like an expensive membership side to the to our website, so we can start to present things that maybe will be censored on the mainstream. So when it comes to empowering your health in a lot of ways. So watch out for that. And yeah, that's the best ways.
Cool. I'll include all those in the show notes. And yeah, thanks so much for coming on. I personally have got a lot from today, and I know people listening will, so I really, really appreciate it.
My pleasure. Thanks for having me on, and thanks for doing this for people, because it's very much needed.